Hello, everyone. Thank you for joining this month's webinar. The topic is Women and Exercise. My name is Dawn, and I'm a health coach with Strategic Health Services, and it's my pleasure to offer this topic for you. We will cover some general exercise recommendations as well as some special considerations for women during different times in their lives. And we will also cover some exercise myths. So what is recommended as far as exercise goes? Well, the general recommendations for health is to accumulate at least 150 minutes of moderate intensity aerobic physical activity a week, and this equates to about 30 minutes a day, 5 days a week. Aerobic means that you get your heart rate up and you keep it up for an extended period of time, and this works the heart and lungs, hence cardiovascular exercise or aerobic exercise. A good way to tell if you're doing moderate intensity is if you can carry on a conversation while you're exercising and it's a little bit difficult, then that's moderate intensity. If it's too easy, you're not working hard enough. If you're able to laugh and, you know, all of that, it's too easy. Now, if you can't talk at all while you're exercising, then you're working out at a vigorous intensity. And for a vigorous intensity, the recommendations is 1 hour and 15 minutes a week, which is 75 minutes of vigorous intensity aerobic physical activity. So either or a combination of the two. The CDC describes your intensity this way. So in general, if you're doing moderate intensity activity, you can talk but not sing. If you're doing vigorous, you'll not be able to say more than a few words without pausing for a breath, okay? So now muscle conditioning is basically working your muscles against some sort of a resistance, whether it be your weight against gravity or a pair of hand weights or exercise bands. But the recommendation is to work all muscle groups in your body at least twice a week. So if you do a split workout where you do upper body on one day and lower body on another day, then you will have 4 days a week where you're doing this workout, right? 2 upper body and 2 lower body days. Now lastly, muscle flexibility, which is not on this slide, but I do want to touch a little bit on it. Muscle flexibility is basically stretching. And the recommendation is to do some sort of stretching every day, again, best for your whole body. And you get your most effective stretching when your muscles are already warm from either physical activity or even a hot shower. It is important to find some type of activity that you enjoy or you won't stick with it. And incorporating variety into your schedule or cross-training is very healthy. Include some of each of these types of activity. Change it up every once in a while. The more that you continue to always do the same thing, the less effectiveness that you have for your health. And so include leisure activities and sports and home activities and, you know, formal exercise. So here are some of the special circumstances that we're going to delve into today for women, including menstrual cycle dysfunction, the female athlete triad, pregnancy, lactation, weight loss, menopause, and even osteoporosis. Now, during the past few decades, an increasing number of women of all ages have been participating in sports at both recreational and competitive levels. Now, most girls and women derive significant health benefits from regular physical activity, but there are many benefits of exercise. However, exercising women could potentially be subject to menstrual cycle dysfunction. The onset of menstrual cycles, or menarche, is generally around 12 to 13 years old. A woman is considered to have primary amenorrhea if she has not started menstruating by age 16 or has not yet begun to develop breasts. In some women, there may be a constitutional delay, especially if the mother was late in developing. But secondary amenorrhea, which basically means absence of a menstrual cycle, secondary amenorrhea is the absence of 3 or more consecutive menstrual cycles after the onset of menarche. Now, athletic amenorrhea or exercise-associated amenorrhea is a diagnosis of exclusion, which basically means that all other medical causes would need to be ruled out, such as pregnancy or thyroid issues or endocrine order issues, maybe excess male hormones or a pituitary tumor, polycystic ovarian syndrome. Anyway, so all of the medical reasons would need to be ruled out before it would be called athletic amenorrhea. And there's no single cause for the onset of athletic amenorrhea. Potential factors include low body weight and low % body fat, rapid weight loss or sudden onset of vigorous exercise, nutritional deprivation, disordered eating, and energy imbalance, as well as athletes with menstrual disorders. Psychological and physical stress can be an issue. So basically, sports that emphasize leanness are more likely to have a high percentage of these types of disorders. For example, the prevalence of amenorrhea in runners is 24 to 26%, and it's higher than those of swimmers, 12%. There's also possibility that there would be a genetic predisposition. The beginning of competitive sports at an early age was previously thought to delay menarche. It's more likely, however, though, that females who are late maturers are more specifically selected for certain sports and disciplines. But intensity exercise and increased frequency of training are associated with greater incidence. But there's really no scientific evidence for any direct cause and effect at this point. So why should you even worry about this? Well, amenorrhea has been linked to premature loss of bone density. It's a symptom of an underlying problem that requires medical evaluation within the first 3 months of occurring. And then the biggest problem becomes infertility. But the greatest unseen risk from prolonged amenorrhea is the loss of bone density or premature osteoporosis. Now, why does this happen? Well, amenorrhea and other forms of menstrual dysfunction are associated with an estrogen deficiency, similar to menopause. And estrogen, and possibly progesterone as well, increase the absorption of calcium. And its uptake and depositing into the bone. So the loss of estrogen may also theoretically increase blood lipid levels and lead to premature atherosclerosis and cardiovascular disease. There are also possibly a higher incidence of cancer of the reproductive organs. So a lot of things to consider. Now, the female athlete triad is a health concern for active women and girls who are driven to excel in sports. It involves 3 distinct and interrelated conditions: disordered eating, which can be a range of poor nutritional behaviors, amenorrhea, which we just talked about, and osteoporosis, which again is low bone mass, which can lead to weakened bones and risk of fracture. Now, anyone may be affected, but women and girls participating in activities which emphasize leanness are especially at high risk. And these activities can include gymnastics, ballet, diving, figure skating, running, aerobics, anyway, any number of areas. So in response to pressure to lose weight, women or girls may practice unhealthy weight control methods, including restricting their diet, self-induced vomiting, consumption of appetite suppressants or diet pills, use of laxatives, and compounds to increase urination. Specific eating disorders are anorexia nervosa and bulimia. And many girls and women hide or deny their eating disorders due to being embarrassed, shamed, fear of losing control of their dieting, and mistakenly believe that excessive weight loss enhances their performance. Really, an unbalanced diet with inadequate caloric intake relative to exercise level and excessive training may predispose them to menstrual abnormalities, as discussed on the previous slide. And then Again, osteoporosis refers to low bone mass and fragility, and low estrogen levels and other hormonal changes which accompany irregular or absent menstrual cycles may predispose females to osteoporosis, especially in their tween years, which is before their teens, and then their 20s, and when bone mass is accumulating. A 20-year-old woman without menses during her critical teenage growth period may have bone mass typical of a 70-year-old woman, predisposing her to stress fractures and other fractures later in life. Adequate nutrition fosters good bone formation. So calcium requirements for teenage girls and young women with normal menses is about 1,200 milligrams per day. Females with irregular or absent menses require 1,500 milligrams of calcium and 400 milligrams of vitamin D per day because that helps the absorption of the calcium. It is important that if you or someone you know exhibits these signs that they be evaluated in order to prevent these long-term complications. Now let's move on to pregnancy. The American College of Obstetrics and Gynecology, lovingly known as ACOG, as well as the American Society for Obstetrics and Gynecology, they recommend that normally healthy pregnant women can continue an already established exercise regimen. So if you're already exercising, you typically can continue to exercise. And participation in regular weight-bearing exercise has been shown to improve maternal fitness, restrict weight gain without compromising fetal growth, and hasten postpartum recovery. In addition, the psychological benefits of exercise are undeniable and should be nurtured by all who care for pregnant women. Now, during the first trimester, there are some major physiological changes taking place. Even though the maternal body, there's few changes. During low-level exercise, blood pressure and pulse responses are not dramatically different from those in non-pregnant women, but fatigue may be noticed earlier in exercise. As early pregnancy progresses, blood volume expands, the uterus continues to enlarge, weight gain is usually small but can range from 0 to 10 pounds. And during this time, the fetus is undergoing its most important growth, including the development of organs and limbs. And for this reason, a proper balance of nutrition, hydration, exercise, and rest are all equally important. It is important for the pregnant woman to avoid large increases in body temperature during exercise. Fortunately, adequate hydration, regular exercise, and pregnancy all improve a woman's capacity to dissipate heat, so that shouldn't be a problem. The second and third trimesters are accompanied by dramatic changes in a woman's body. Normal weight gain ranges between 22 and 35 pounds and is centered around the abdomen and pelvis, which alters both the woman's posture but also the center of gravity. So during this time, exercises requiring balance and agility may become more difficult due to the change in the pregnant woman's weight distribution. So the use of properly adjusted exercise equipment, a smooth floor surface, and/or aquatic exercises are extremely helpful. And the extra caloric demands of pregnancy are extremely variable. There's no fixed equation that accurately estimates the amount of increased caloric need. The best measure of sufficient caloric intake is adequate weight gain. Pregnant sedentary women commonly require about 3,000 calories a day during the second and third trimesters to ensure adequate stores of nutrients. And then, physically active expectant mothers would therefore have a higher caloric need in order to compensate for the calories that they're burning during their activity. Now, once the baby gets here, let's talk about now lactation. So the American College of Obstetrics and Gynecologists, again ACOG, recommends women resume physical activity after delivery as soon as it's physically and medically safe. So wait until you're cleared by your doctor. In addition, the American Academy of Pediatrics recommends that all women breastfeed their infants during the first year of life. Now, this is a very personal decision, but the effect of exercise on milk volume and composition, and consequently infant growth and health, must all be considered. So, results from studies with lactating women suggest that exercise improves aerobic fitness and plasma lipids and insulin response and does not affect breast milk composition and volume or infant growth. In addition to the benefits of aerobic exercise, there are beneficial effects of resistance training, again, on the bone mineral density in lactating women, because during lactation, approximately 200 milligrams of calcium is transferred to breast milk each day, and this results in a 3 to 9% loss of bone mineral density in the lower lumbar spine. Bone mass usually returns to pre-pregnancy levels when the infant is weaned, but not all women, not in all women, not all the time. So resistance training and other weight-bearing exercises can help maintain your bone density and even increase it back up to normal levels after your baby has weaned. Okay, so now that you've had the baby's been weaned, let's talk a little bit about weight loss. And this is weight loss for anyone. So if you want to lose a substantial, by substantial I mean more than 5% of your body weight, amount of weight, then you need a high amount of physical activity, unless you also lower caloric intake. So this is the case if you're trying to keep the weight off as well. Many people need to do more than 300 minutes of moderate intensity activity a week in order to meet weight control goals. The best way to lose weight really is to do both, eat less and move more. So it takes a caloric deficit of 3,500 calories to lose 1 pound of fat. So 3,500 calories is equivalent to 1 pound of fat. So to lose 1 pound in a week, that means creating a calorie deficit of 500 calories a day. To lose 2 pounds a week, that would be 1,000 calories a day, which is impossible through reducing your caloric intake alone for most people. Now, how many calories you burn depends on your age, gender, and other factors, but generally, here's a few examples of what it takes to burn 500 calories with exercise in a day. So that would be running 30 minutes at 8 miles an hour, jogging 60 minutes at 5 miles an hour, swimming laps in a pool consistently for 60 minutes, mowing the lawn for 2 hours using a push mower, hiking for 2 hours, tennis for an hour, high-intensity aerobics for 50 minutes, cycling for 75 minutes, anyway, a spin class for 45 minutes. Anyway, these are just some examples. Now, you may not be able to get that type of physical activity every day, okay? So combining exercise and calorie reduction can help you hit that goal of creating your calorie deficit of 500 to 1,000 calories a day, depending on what your weight loss goals are. Okay, so on to menopause. Well, what is menopause? Menopause is defined as occurring 12 months after your last menstrual period and marks the end of menstrual cycles forever. Menopause can happen in your 40s or 50s, but the average age is 51 in the United States. And the exercise recommendations for women in either peri or postmenopause are very similar to those recommended for all women. Starting an exercise program can be difficult, especially during a time when your hormonal fluctuations result in a variety of physiological and psychological changes. The key is to remember that the main goal is to boost your health, minimizing any symptoms brought on by these natural body changes, and it's important to choose activities that you enjoy. So any cardiovascular activities such as brisk walking or cycling, water aerobics, mowing the lawn, anything that causes you to elevate your heart rate and break a sweat while still being able to carry on a conversation is adequate for meeting the ACSM, or American College of Sports Medicine, guidelines or recommendations that we went over before, which is the 30 minutes a day, at least 5 days a week. So even short bouts of exercise lasting 10 minutes at a time can be accumulated throughout the day to meet this goal. In addition to the cardiovascular exercise, again, twice a week, strength training, working all muscles, but with at least 8 different exercises of 8 to 12 repetitions, working the entire body can have really positive outcomes for you. And so for both cardiovascular and strength training exercises, remember to increase the amount of exercise that you do gradually, especially if you're not accustomed to exercise, starting with realistic amounts and moving towards achieving the minimum recommendations that we just covered. Exceeding the minimum recommendations further reduces the risk of inactivity-related chronic diseases and can be helpful in minimizing your symptoms of menopause as well. Special consideration should be given for those women who are especially affected by hot flashes. Research has shown that a relaxation-based method with paced respiration significantly reduces objectively measured hot flash occurrence. With this in mind, programs that encourage focused relaxation and breathing like yoga, maybe Tai Chi, they can be beneficial for reducing hot flashes. While the benefits of the cardiovascular activity are numerous, researchers have not consistently found positive effects specific to hot flashes, that is, although it may work for some women. But as always, it is important to consult your physician on a regular schedule as perimenopause approaches, and work with your doctor on balancing the changing needs of your body, and be sure to exercise to help manage complications brought about as we age. Okay, so let's talk a little bit more about osteoporosis. Again, it's characterized by low bone mass, structural deterioration of the bone leading to bone fragility, and increased risk of fractures of the hip, spine, wrist. For women, bone loss is fastest in the first few years after menopause, and it continues into postmenopausal years. And the risk factors include well, certain risk factors are linked to the development of osteoporosis and contribute to the likelihood of developing the disease in the first place. There are some risk factors that you can't change, like your gender, age, body size, ethnicity, family history. But the risk factors that you can change include, your sex hormones. If abnormal absence of menstrual periods, amenorrhea like we talked about, low estrogen levels in menopause, and low testosterone levels in men can bring on osteoporosis. So talk to your doctor about these things. Anorexia nervosa, again, the eating disorder we talked about, is characterized by an irrational fear of weight gain, and this eating disorder increases your risk of osteoporosis. So recognizing it and getting care as quickly as possible can help reduce your risk for osteoporosis later. Calcium and vitamin D intake are very important to prevent osteoporosis. If you have had a lifetime diet low in calcium and vitamin D, that makes you more prone to bone loss. There are some medications that long-term use of these medications, such as glucocorticoids and some anticonvulsants, can lead to loss of bone density and fractures. And likely, if you're on those types of medications, your doctor has talked to you about this. You have control over your lifestyle. An inactive lifestyle or extended bed rest tends to weaken bones. Cigarette smoking is bad for your bones as well as your heart and lungs. And alcohol intake, excessive consumption of alcohol, that is, increases the risk of bone loss and fractures. So let's talk about prevention. To reach optimal peak bone mass and continue building new bone tissue as you age, you should consider several factors. the calcium, vitamin D, smoking, alcohol, medications, all of those things. If you have concerns about any of these, talk to your doctor about it. And exercise is an important component of an osteoporosis prevention and treatment program. Exercise not only improves your bone health, but it increases muscle strength, coordination, and balance, and leads to better overall health. Although exercise is good for someone with osteoporosis, it should not put any sudden or excessive strain on your bones. As extra insurance against fractures, your doctor may recommend specific exercises to strengthen and support your back. And they may recommend weight-bearing exercise. Well, what is weight-bearing exercise? I get that question a lot. It is any exercise done against a resistance, including gravity. So this can include walking, as this provides the force of gravity against your bones, including your spine, when you are in an upright position. Also, this includes any kind of muscle conditioning exercises that you might do with exercise bands or hand weights, or any exercises you do standing against gravity, such as squats or lunges. Okay, so real quickly, let's just cover a few exercise myths that women oftentimes are concerned about. Working out will give me big muscles. Not necessarily. Females won't get big muscles like men because males have 10 times more testosterone as females. So unless a female decides to take supplements or other unnatural means to get more testosterone, there is only so much muscle to be gained. Now, some women do have more testosterone than others, so you may see that some women get bulkier than others, and that can also be genetically determined. Secondly, you can target your fat burn, also referred to as spot reduction. Well, that's not true either. I often get questions about, I just want to lose my gut. I don't want to lose weight anywhere else, just in my gut. Well, sorry, it doesn't work that way. Working out can reduce your overall body fat, but you can't control where that fat comes from. That is also genetically predisposed. And usually the last place you gain is the first place you lose, so usually you lose it in backwards order of how you gained it. Thirdly, it's too late to get in shape. Well, that's not true either. It's never too late to begin a healthier routine. Even if you're older, you can always start to exercise. Yes, you should start slowly by starting maybe by walking 5 or 10 minutes at a time, gradually increasing the time, or adding strength training after a few months. Get help from a professional, but it's never too late to start, and obviously get cleared by your doctor first. The fourth one is that menopause makes it impossible to lose weight. Well, that's not true either. I've coached several people who managed to lose weight during and after menopause, so it is not impossible, I assure you. It may not be as easy, but it's definitely not impossible. Lastly, just doing cardio will help you lose weight. Well, that's not necessarily true. Maybe because of your calorie deficit, but it is really best to combine cardio with strength training to trim your waistline. Cardiovascular exercise increases your metabolism instantly, but that increase dwindles a short time after your cardio workout. While weightlifting and building muscle keeps your metabolism going longer and stronger. I've often said that, the more muscle you have, the more calories you burn at rest. That is your metabolism. So it's best to combine both cardio and weights. Okay, so, gosh, obviously, we've covered a lot of information, and I just want to, remind you that with any exercise program, be sure to talk to your doctor. If you have any special concerns, a variety of exercise is best, but too much of any good thing can be detrimental, even with exercise. So change it up. Starting any new exercise program, do it slowly and work up to more time and higher intensities, and get professional help. Find a fitness instructor or someone who's trained in it if you're not sure, okay? Or talk to your health coach. So, as always, I want to thank you for taking the time to attend this month's webinar. I want to remind you about all the tools on My Pathway to Health. Also, remember your health coach is available to help you with any health-related goals or concerns. You can contact us either through the 800 number on this screen or through secure messaging on My Pathway to Health. We look forward to assisting you with your health goals. Also wanted to remind you that you can view this and all webinar recordings on the Strategic Health Services YouTube site. Now, this concludes this month's webinar. Thank you for joining, and have a great day.